In the next minute or so, we'll look at how different health and ageing issues may affect our ability to drive. As we get older, some of us start to notice changes in our health. This can include changes in vision, movement, reaction time, the use of medications, and the effect that alcohol can have. In the following video clip, Maurice O'Dell, a senior forensic physician, will explain how ageing can impact on our driving ability, and will also outline the importance of reporting medical conditions to VicRoads. In addition, Marilyn DeStefano, an experienced occupational therapist, will discuss what you may be required to do if you're referred to VicRoads for a driving assessment, as well as introducing some common vehicle modifications for people with physical limitations or disabilities.
Ageing can have all sorts of effects on the ability to drive. Driving is one of the most complex things we do, even though it's something that we're all very much used to and that we've got used to over many years. But really, it requires a lot of mental and physical concentration and coordination. People have to be able to think quickly, concentrate, anticipate, track other moving objects, and respond very quickly sometimes if there's a sudden change in driving conditions. So all those things are quite a high load for the brain and the body to deal with, and the ability of people to deal with those things changes as we all get older. There are common health conditions that happen as we get older that can affect driving. Most people have some change in their eyesight as they get older. They might need to wear glasses, or they might have other conditions that need attention. They might develop cataracts and so on. People can have conditions like neurological changes or epilepsy. So there's a whole range of things that can change as we get older without necessarily disabling us, but just make this really complicated task of driving much more difficult. It's very important that medical conditions that can affect driving do get reported to VicRoads. If a person with a medical condition has a crash or an accident and that condition wasn't known to VicRoads, that can have adverse effects on insurance companies paying out for the crash, and it can even affect the way that the police view responsibility for the collision. When you're seeing a doctor about anything like this, it's important to bear in mind that almost any medical condition that you're seeing a doctor about might have an effect on driving, on this very complicated task that we do. And, ask, get the information, and that's the best way to try and remain as safe as you can and to remain as mobile as you can for as long as possible.
Occupational therapists are members of the healthcare team, and they work alongside doctors, physiotherapists and nurses. Our specific role is to help a person to become independent and to overcome any barriers that might be caused by a health condition or disability. The occupational therapy assessment is in two parts. There's an off-road assessment, which is where we sit down with the person and then we actually get them to drive around a particular route. At the end of the off and on-road assessment, the occupational therapist will sit down with the driver and family members and discuss what options are available for licensing, for vehicle modifications, for vehicle choice, and for a remediation program. What you can see here are hand controls, and they are used for people who can't manage to use the normally located foot pedals to operate acceleration and braking. A steering device on the steering wheel might help people who have limitations in hand movement or pain or restrictions in their joints to manage the task of steering. Sometimes additional mirrors are applied to the inside of a vehicle, and they're usually used for people who might have difficulties with neck restriction or movement, and they will enable that person to have a much clearer view of the environment to the side and rear of the vehicle. There are lots of ways we can assist a person with medical conditions or disability or functional limitations to retain their driving independence.
It is important to be mindful of our health, and health is just one of the many topics covered by the Years Ahead presentation. The program involves a 1-hour discussion-based presentation and is available free of charge to organised groups of seniors throughout most of Victoria, such as senior citizens clubs, probus clubs, church groups and retirement villages. If you'd like to learn more about how health issues can impact on our driving as we age and other road safety topics, then call 03 9790 2915 to book a session.